What does one do in such circumstances? There are premature babies. And also, what does one do really for ladies who are expecting a baby now to ensure that they don't pass on any infection to the newborn?
So basically, there are two things to this thing: whether that infection of the mother does have an impact on the baby or not. Now that's the first part of the question, and then the answer to that question is that yes, it does have, like whenever the pregnant lady gets COVID infection, there is a risk which increases slightly of a sickness level being higher than a non-pregnant female in the mother. And sometimes infections in the baby, in the mother, can actually lead to adverse pregnancy outcomes like abortions or even stillbirths or premature births. And this particular wave with what happened last month, we had a flurry of babies who came with premature delivery because the mother had COVID, and then they went into premature labor. And that's a concern that we think that in future also exists for us when the third wave comes. And that's so again, the protection is about protecting yourself from people who have a risk of transmitting the infection to you. So again, which means that doing things like baby showers and celebrations around this thing should wait for things to for pregnant ladies and going out. I understand it can be quite exhausting for women to be sitting at home and not going out, and because they are, but it's not the time to do that kind of adventure for sure. And in future, probably we have there was a recent study from ICMR which suggests that the pregnant females should also get vaccine. We do not know when that gets licensed by the government, but whenever it gets, you probably would want to get a vaccine as a third layer of protection. But once the baby is born, in that thing, again, you need to see there is a cocooning effect. There is the infection the child is in a cocoon, and the surrounding the cocoon are people like father, the mother, the grandmother, the grandfather, and the persons who are going to take care. So number one, that you need to make sure that your children are protected against, your family is protected against all the diseases, like including flu. For example, grandparents should also get a flu vaccine so that the child doesn't fall sick to a non-corona illness as well. And whooping cough could be another thing. So every 10 years, one is supposed to, maybe that's something because your company is looking after so many old people as well with Save at Home. I mean, that's something, a mandatory 10-year Boostrix vaccine is to be given to all people who are more than, and pneumococcal vaccine, for example, all adults should get, and that is the kind of protection that we need to protect to all our family members. And the mother and father should maintain a corona appropriate behavior and not get into a celebratory mode so soon. And once you have a ring around the baby, which is of people who are not going to have or less likely to have an infection, you are less likely to do transmit, because even if the vaccine is available for children, it's not going to be available for children less than 2 years.